Welcome to Discover Health, a White Mountain perspective. I am your host, Dr. Tom Barela. On this program, we explore issues that are prevalent in the White Mountains. Today's topic is Infections and Prevention 2016. Our guests today are Janelle Lynn, RN, Nursing Supervisor for the Navajo County Public Health, and Kathy Solomon, RN, Infectious Disease Nurse, also from the Navajo County Public Health. And I would say welcome to both of you.
Thank you.
We have an interesting topic today, both from a public standpoint and incredibly from a public health standpoint. So let's start out a little bit and kind of discuss the role of the nursing in public health, and especially in communicable diseases in our county.
That's a pretty broad role. We handle the private providers and hospitals report to us. So when an infectious disease that is a mandated reportable by state or federal law comes into play in one of their practices, they report that to us. And we handle the surveillance and prevention end of that. So that can be anything from STDs to TB to vaccine preventable diseases to newly emerging diseases. There's a broad realm.
A broad realm.
Mm-hmm.
And an incredibly important realm. And you mentioned communicable diseases that are vaccine preventable. So let's start there today and talk a little bit about vaccine preventable diseases.
Okay.
What is the county's role and your role in the vaccine preventable diseases?
So like I said, we do everything from the surveillance. So if a vaccine preventable disease is reported to us, one of the things we do is we start by checking that child's vaccine record to see if they were vaccinated, if it may have been a vaccine failure, if they were off schedule, things like that. If it's something, say pertussis, there may be some prophylaxis that we need to go out and offer to close household contacts to keep them from contracting the illness. And then we also have a vaccine program. So we offer vaccines to adults and children.
So the county health departments have vaccine clinics?
Yes.
They are free?
They are, if you have insurance, we bill your insurance, and they are free to those who are uninsured or underinsured, which means that your insurance plan does not cover that vaccine, then they would be free.
And do you need appointments to get into these clinics?
You can do those by appointment in our Holbrook, Shoalo, or Winslow offices, or we have walk-in clinics scheduled in those offices. We also go into schools and offer them on-site. In schools, there's a variety of methods you can obtain your vaccine.
So if they don't get it at their physician's office, they can certainly get it at the county health department. Now,
yes.
You talked about vaccine preventable diseases. That's been a big topic in the news this year for a number of standpoints. So tell me a little bit about vaccines and why they're important for us and more so for our community.
Well, when vaccines were first coming out, so the main one is smallpox, polio, things like that. Number one, with the development of two different things, sanitation and vaccines, within a year of those being available, the lifespan doubled. So they're highly effective. So they protect us against diseases that circulate in the community. So it's really important that we get vaccinated. We're not only protecting ourselves, but we're helping protect our community and keep our community healthier. And every year they come out with new vaccines. Vaccines are not just, readily released. They are studied for years and decades to determine efficacy rates, to determine the best spacing, for the best result. And so once they're released on the market, there are so many things that you don't have to suffer from anymore because there's a vaccine available for that. Everything from meningitis, diphtheria, whooping cough, hepatitis A and B. There's such a broad realm of vaccines available now.
And I think it's important for people to understand that we have all of these infections in our community, and a lot of people your age and younger and older don't remember the years that we had all of these types of infections.
Right.
And even though you may get immune to the infection or the things that you come across, you know, the purpose of the vaccine is to prevent you from getting all of the side effects and the risks of getting some of these diseases.
Right.
And I know that you talk about whooping cough. Whooping cough was an interesting illness because back the first vaccine that we had for whooping cough had severe side effects, and the children were getting high fevers that a lot of parents really didn't want to subject their children to that. And in the early 1990s, England stopped immunizing their children for whooping cough or pertussis, and their death rate went up to pre-immunization rates within 1.5 years. So attending essentially to what you're saying about the vaccine preventable. Now, talk a little bit about the concept of immunization in a community and the ability to prevent essentially epidemics, because that's really what your job is, isn't it? To prevent epidemics?
The higher the vaccination rate in your community, the better protected your community is against a circulating infectious disease. And that can be anything from influenza to something, you know, more with longer lasting side effects like meningitis. And so there's something called herd immunity, and herd immunity is where we are relying on the high vaccination rate of a community to protect us. What herd immunity is designed to do is to protect those that can't be vaccinated. So infants, immunocompromised individuals, you know, for some reason that person can't be vaccinated, then a high vaccine coverage rate is great because you have herd immunity and it helps protect those more vulnerable members of your society. What's happening though is we've become too dependent on herd immunity, and there's not a high enough percentage of our communities that are vaccinated. And so it's a false sense of security, and we are weighing too heavily on that false sense of security with modern travel, with newly emerging diseases, things like that. We're going to start to see these diseases circulate through our community again, and our vaccine coverage rates have declined, which means we don't have as high of a level of herd immunity. And I think that people don't realize we're relying on that false sense of security. It is important to be vaccinated, to vaccinate your children, and to protect yourself and your community.
And well, let's talk a little bit about that now. The overall community immunization rate must be incredibly high, because is it not required for school attendance in most cases? There are required vaccines for school, but it depends on the disease that's circulating. So I know for MMR, you have to be, it's something like a 98% herd immunity to be adequately covered if measles, mumps, or rubella circulates through your community. It's difficult to totally assess the coverage rates of our community, so we do that by assessing the schools, because schools are mandated that they have to either sign exemptions or be vaccinated. So they have the records,
right?
essentially.
So that's the easiest pool of your population to assess. But you have to consider that children are usually more well vaccinated than adults. So that's not a totally accurate reflection of your community either, because most of the adults are less vaccinated than the children. So we have some areas in our community that have 0% exemption rates, and which means that every student in that school is up to date on their vaccines, and that's awesome. Our Winslow schools, a lot of them have a 0% exemption rate, so everybody's vaccinated. But we have a couple of pockets in our community that we worry about, that concern us, because they have a high exemption rate, which means that the parents have signed an exemption, and they're not, most of them, very few of them are for medical exemptions. Our Heber area, the Mountain Meadows School, has a high exemption rate. They have our highest exemption rate in the county at 17.9%. Our Snowflake and Taylor Elementary Schools have high exemption rates in the 13 and 14%, and our Joseph City School District has a 13.5% exemption rate. So those communities are more vulnerable, and that concerns us.
And that, of course, is just an at-risk factor. And in fact, there are communities around the country that have reported many epidemics among the unimmunized.
Yes.
And we have seen that for whooping cough all over the United States, especially with the previous whooping cough vaccine.
Right.
Now, when you receive these vaccines, do they protect you for life, or do you have to?
It depends on the vaccine. Usually there's an initial schedule, and it's a series, anywhere from 1 to 3. Hep B has a is a 3-dose series, and then you're supposed to be, covered for life. Some of them require boosters. MMR, you get one after age 1, and then you get one when you get ready to enter kindergarten, and then they say you're covered. Tetanus has a booster every 5 to 10 years. You should get a booster of your tetanus. It depends on the vaccine.
Okay. And especially tetanus, and now whooping cough is going into the adult years, and in terms of prevention and stuff. And you mentioned measles, mumps, and rubella. And I know that everybody that's going to watch this show is going to say that, measles, mumps, and rubella causes autism.
Right.
And that's been a large part of the press recently. So can you talk a little bit about that?
One of the things that we spend a lot of time doing is trying to dispel the myth that there is a link between autism and the MMR vaccine. There was a physician in England who supposedly did a study and had a link between that showed a link between MMR and autism. First of all, he was a gastroenterologist. He wasn't a vaccinologist or any
infectious disease
doctor or anything like that. It's been proven that he falsified that study. He's admitted he falsified that study. And the Institute of Medicine, who is a non-biased group who does a lot of the research behind vaccines and for the U.S. government, has tried to replicate that study unsuccessfully. And over the last couple of decades, they've spent a lot of time trying to dispel this myth. And I think it was in 2004, they did over 200 studies. None of them were able to provide a link between autism and the MMR vaccine. In 2011, they did over 1,000 studies, and they were unable to provide or to determine any link between MMR and autism. It has been proven that there is no link. They've studied groups of kids who received the MMR versus groups who didn't, and the occurrences of autism were almost mirrored in the non-vaccinated versus the vaccinated group. So we encourage people to get your information from evidence-based sites, scientific information, and not go with your fly-by-night random opinions that you see all over the internet.
The nice thing about the internet is anybody can express an opinion, but as the TV commercial for, I forget which insurance company, you can't believe everything you get off the internet. Nevertheless, this is an important issue because of autism is such an emotional topic nowadays, and will continue to be essentially as any illness that doesn't have a defined cause and or treatment along the way. So from that standpoint, we continue to encourage everybody to get as much immunizations as we can. And as a physician, I would say that most of today's generation does not recognize the illnesses that we used to deal with in the past. And I would say one thing about your herd immunity issue, the reason why the herd has to be so high is because some of these diseases are incredibly contagious, like measles and chickenpox. Now, even though chickenpox doesn't have horrible side effects, other than it's a horribly painful and miserable illness to have, it still has an over 95% contact or infectious rate, which means you have a 95% chance of getting it if you come across someone with it. So let's go further and talk about our community. And there's other illnesses that are along the lines in the community, and that will turn a little bit. You've been quiet so far, Kathy, and yet you're right in the midst of things. In the White Mountains, there are several illnesses that we have, a little bit unique maybe, and also again in the national spotlight for a risk factor, not so much in the wintertime, but in the summertime it's going to be. So let's talk about some of the diseases that we have to worry about up here that are out of the normal milieu of the vaccine preventable illnesses. And some of those illnesses are?
The ones that are in the news right now, or have been for the past couple of years, the big one right now is ZIKA. The other one is chikungunya, and the other one is dengue. And they're all very similar diseases. They their symptoms are very close to each other. The rashes are very close to each other. And when you test, the tests sometimes have a hard time determining which one it is, since they're all flaviviruses. And so it's kind of a little bit different. None of those have a vaccine in the United States that we can use here. But going back to the vaccines, with rubella, the congenital rubella syndrome, there was an outbreak in 1963, and many of the effects on the fetuses are the same as what Zika is doing now with the microcephaly and the...
Well, let's talk specifically. What is Zika virus from our standpoint?
All right.
And then we could go back and talk about that association with rubella.
No problem. The Zika virus is a virus that is spread through the Aedes mosquito. So what it is when you get bit by an infected Aedes mosquito, then you've been exposed to this virus. And only 80%, not even 80% of people who are exposed to the virus are asymptomatic, meaning they never develop any symptoms. And those who do only get sick for about a week. And those symptoms would include a fever, they get a rash, they get joint pain, they get the red irritated eyes or conjunctivitis, they end up with muscle pain and tenderness, and headaches. And so for an adult, it's not really that big of a deal. It really only comes hugely into play for a pregnant lady. Lately, they've found one other way that it's spread. It stays in a person's blood for a while, but it stays even longer in a male's semen. So a pregnant lady can also be introduced to the virus that way.
Okay. So essentially, from what you're saying, does that mean that if you get infected while you're pregnant, or now, even before you're pregnant, or if you're having intercourse during the beginning of your pregnancy before you know you're pregnant, you're at risk of infecting your fetus?
Yes and no.
Okay.
There has been, none of the studies have shown that if you are introduced to the virus before you're pregnant, that it will affect the fetus. It only affects the fetus if you're pregnant at the time that the virus is introduced to yourself.
So pregnancy has to come first.
Correct. So if you've had Zika in the past, it has no bearing on your current pregnancy.
But that means if you're having intercourse during the first month of your pregnancy, before you know you're pregnant, that could have some of the consequences to the baby that's forming in you. And, we heard initially that Brazil was the place that was at high risk for this. So, and the initial studies, did they not come to the United States, were people that had traveled to areas of the world where Zika was? And now, do we have to worry about it in the United States?
The United States has never had a locally acquired case, which means people who do not travel to a place that has it have not gotten it so far. It's considered a travel virus at the moment. So if you go to places that have it endemically, Brazil, parts of the Caribbean, Mexico, Southern Americas, or South America, those areas, but there have been travel-associated cases, and we've actually had one travel-associated case in Arizona now. It was just last week or the week before. But as far as that goes, only travel-associated Zika has happened so far, but we are still at a low risk because we do have the Aedes mosquitoes here, and wherever they are, then there's a risk. And Mexico and the territories of Mexico that are close to Arizona are having locally acquired cases of these mosquitoes.
In honesty, you got to remember, though, that the infections were in the southern hemisphere during their summertime.
Yes.
And even though we haven't had any in the United States, the issue is going to be for us is when mosquito season comes during the summer months in the Northern Hemisphere, just what's going to happen. And I don't think we really know yet what is going to be. And so are they predicting that we in the White Mountains are and in Arizona are going to be a risk area?
The state has declared it a low risk area. And where the risk comes in is because we have this mosquitoes here, people who travel to infected areas and develop the Zika virus or the Zika illness, and then they come back to the United States while they're still infected. If they get bit by a mosquito here, then the mosquito who bit them now is infected with it. And so if they go off and bite somebody else here, we have a population that has no immunity to this. And so that's where the risk comes in.
Wow. But let's go back to the issue of rubella. There is a lot of similarities, is there not, to rubella in the 1960s you were mentioning? How close is that association?
The symptoms were that the illness itself, let's put it that way, wasn't necessarily horrendous, but when it came to being introduced to the fetus, it was very much more complicated. They would get the microcephaly, they would get the growth development issues and the mental retardation issues and things like that. And one of the biggest things is a lot of those children who did make it through to the point where they were born and they
alive.
A lot of them ended up being deaf. The Zika, the things that it will do to a fetus are very similar. One of the bigger differences, however, is that there's a lot of problems with the eyes. They may develop small eyes or blindness or whatever, as opposed more to the hearing side.
So this is an important correlation. Essentially, in the 1960s, rubella was recognized as a virus. German measles is what rubella was, and it was a very mild illness. You're saying the same thing for Zika virus. 80% people don't even know they have it. And the problem is, of course, if you're pregnant during the time period that you contract this virus, it should be recognized that, in 1963, that the country started clamoring for a vaccine because for German measles, even though it wasn't a severe illness, to protect the women. It took 7 years. Is it 7 years to get a commercially widespread vaccine? I know that it was about 6 years before they had a vaccine. Now they're talking about
trying to get vaccines for some of these. The Zika virus they're working on, obviously. Dengue virus they've been working on for quite a few years. Yeah,
it's going to take them maybe 2 years to get a Zika virus vaccine. Mm-hmm. All right, let's go forward. Dengue virus is not really a big virus up here, but there are a couple of things that we need to talk about. I think it's important for our viewers to understand that that Zika virus symptoms are very similar to flu. Mm-hmm. Now, we don't get flu much in the summertime here, but we have a couple of flu-like illnesses. One of them is this illness. Dengue fever is flu-like symptoms, and chikungunya virus, I always mispronounce that, also is the flu-like symptoms, but they have rashes associated with them. But up here in the mountains, we have a couple of other illnesses that are really important to recognize. And you were mentioning one of those before we talked, and that's Rocky Mountain spotted fever.
Mm-hmm. Correct. The thing that makes the Rocky Mountain spotted fever unique in Arizona, and especially in Navajo County, is that Rocky Mountain spotted fever is carried on the tick. And so you become infected by an infected tick when you get bit. The Rocky Mountain spotted fever had been being carried on the American dog tick and the Rocky Mountain wood tick, which is mostly in the east of America. And then all of a sudden we started getting these illnesses.
And what
here.
are the symptoms of it?
The symptoms are very close to the same stuff that we've been talking about. The biggest thing over in the East was the recognition of an acute high fever. The difference with the one starting here in Arizona and in Navajo County in 2003 was that they didn't always even have a fever.
So is the rash is maybe a high fever followed by a rash?
Sometimes in Arizona, they don't even get the rash until
So how
the
do you know
late
whether you have
stages.
it?
That's just it. It's a very difficult one to determine because with the Rocky Mountain spotted fever, you can be dead within 8 days of getting your first symptoms. So if the doctor waits for the results of the lab to come back before they're treated, his patient could be dead, or her patient could be dead.
All right, well, we're almost out of time here, and I just want to mention one other illness that you mentioned on your list, and that's hantavirus. And we don't really have time to talk about it, but we have seen hantavirus here up on, especially on the White Mountain Reservation, and that comes from
infected rodents. And around here in Arizona, our biggest one is the deer mouse.
So don't take deer mice and stuff. This has been an excellent program in terms of recognizing that we have a lot of illnesses up here that, number one, are preventable by immunization, number two, preventable by a little bit of habits and by recognition of the illnesses and stuff. And I thank you both for coming here. I know that the job that you do is incredibly valuable for the community. And I want to thank you for watching our Discover Health program today. Please remember that healthy habits lead to a healthy life. And thank you to our guests.
Thank you for having us.